the lateral aspect and superior aspect. Lateral aspect of and superior aspect of the vault of the cranium. Clear? So these two. Clear? So how to determine the site? So we have to know the parts of the bone. This bone, this is the right parietal bone. Okay, this bone have anterior superior angle. This one is anterior superior angle. This one is posterior superior angle, anterior inferior angle, and posterior inferior angle. A anterior border,
superior border, inferior border,
and
posterior border,
a external surface and a internal
surface.
So this bone is easy because it have 1, 2, 3, 4 angle,
4 borders,
2, 3, 4 border,
4 borders, 2 surface.
So this bone is very simple. This is a flat bone. So ossification is membranous. Clear? Now how to hold in anatomical position? From the this external surface is convex, smooth and convex, but this internal surface is concave and grouped by vessels. But this external surface is smooth and convex. Clear? So external, internal. Now superior and inferior. This inferior border is bevel and sharp. This one is sharp. Okay, but the superior border is thick and it is not sharp. Clear? So the superior border is thick and not sharp. Inferior border is sharp and bevel. Clear? So superior and inferior done. Now anterior and posterior. You just look at the 4 angles. 1, 2, 3, 4. So this angle is different because again this anterior inferior angle is sharp. This anterior inferior angle is thin. Clear? And pointed. So you can describe the external surface, you can describe the internal surface, you can describe the superior border, you can describe the inferior border, and also the anterior inferior angle. It is pointed, it is sharp, it is thin. Clear? So how to hold in anatomical position? In pen holding position, this is the anatomical position of right parietal bone. Clear? So those who come late, you will get 2 parietal bone in cranium. You will get 2. I am giving the division. You will get 2 parietal bone in the cranium. It is forming the superior aspect and lateral aspect of the vault of the cranium. This one is the vault and this one is the base. Now come to this parietal bone. This one is one of the easiest bone of cranium. This bone have a anterior superior angle, anterior inferior angle, posterior inferior angle, posterior superior angle. So 4 angle. Anterior border. This border is anterior border or frontal border. This border is anterior border or frontal border. This border is superior border or sagittal border. This border is posterior border or occipital border. Clear? And this border is inferior border or temporal border. Clear? So anterior border, frontal border, superior border or sagittal border, inferior border or temporal border, posterior border or occipital border. Have a external surface. External surface is smooth and convex. Smooth and convex. Have a internal surface. This internal surface is concave and marked by groups of vessels. So how to hold in external surface will be external. This will be in the medial side, okay. And anterior inferior angle, this anterior inferior angle is the identification mark. So you have to hold in this pen
holding position.
This anterior inferior angle is sharp, pointed and thin.
Thin.
Clear? Sharp, pointed and thin anterior inferior angle is the identification point. If you identify the anterior inferior angle, you can hold in anatomical position. Because only this angle, only put this angle anterior inferiorly. Anteriorly and inferiorly. So this is the anatomical position. And what are the other criteria that you have to utter? Clear? Clear? Now come to the superior border. Anterior superior angle. This anterior superior angle, this one is the anterior superior angle. So this anterior superior angle with articulate with the superior angle of the frontal bone and forming this point. This point is big. Clear? And this clear? This one is the anterior superior angle forming the big with the superior angle of frontal bone. Clear? Now come to the posterior superior angle. This posterior superior angle articulates with the superior angle of the occipital bone, forming the lambda. Clear? Now come to the anterior inferior angle. Now come to the anterior inferior angle. This angle.
Sharp.
So this will be this angle. So this anterior inferior angle. It articulates with the frontal bone, it articulates with the greater wing of the sphenoid bone, frontal bone, greater wing of the sphenoid bone,
Temporal.
this one is temporal bone, okay. So this point is the meeting point for four bones, greater wing of the sphenoid, frontal bone, temporal bone and anterior inferior angle of the side. This point is known as terion. Deep to this terion. So this point will be the terion. Deep to this terion, you can visualize a groove. This groove is for the anterior division of middle meningeal artery. So this, the number one structure which lies at the terion, you can visualize the groove. So this is number one will be the middle meningeal artery, anterior division. Clear? Number two, you have not go to the brain. Brain have different sulcus and gyri. Sulcus means depression and gyri. Gyri means elevations. One of the most important sulcus that you have to identify, that is lateral sulcus, and you have to identify the central sulcus. Lateral sulcus starts from this point. Here lies the anterior perforated substance of brain. From this point, and the stem of the lateral sulcus goes like that. Okay. So at this point it is terion. So at this point it is the stem of the lateral sulcus. So number two structure which lies at the terion is the stem of the lateral sulcus. Number one it is
The anterior
division of the middle meningeal artery. Number two it's the stem of the lateral sulcus. Third, you have not go to the functional area of the brain. It's the Broca's area. Okay. It's related with speech. Clear? It's the Broca's area 44-45 lies here. And insular cortex, that also lies here. But you have to at least say the anterior division of middle meningeal artery, stem of the lateral sulcus. Clear? Broca's area you can say, you may not say, but these 2 points you have to say. And the fourth one is insula. Clear? So anterior superior angle, anterior inferior angle. Now come to the posterior superior angle. This one is the posterior superior angle. It articulates with the occipital superior angle of the occipital bone. This point is known as lambda. Okay, clear? Now come to the posterior inferior angle. This angle again, it is the meeting point of 3 bone. From superior it is the posterior inferior angle of parietal bone, and this bone is the
occipital.
So superior angle, lateral angle of the occipital bone, and this bone is the mastoid part of temporal bone. So this is the meeting point of the three bones. This is known as asterion. This is known as asterion. Now look at the interior of area of the asterion. This is the asterion. This is the asterion. So here. So this one is the superior sagittal sinus. This one is the transverse sinus, and this one is the sigmoid sinus. Yeah, and sigmoid sinus goes interior to. It is internal jugular vein, superior sagittal sinus, transverse sinus, sigmoid sinus. Thereafter, via the jugular foramen, it is internal jugular vein. So here at this point, I mean this point. At this point, which sinus lies? This sinus is the sigmoid sinus. Look at this S. This one is the sigmoid sinus. So at the asterion, this sinus means sigmoid sinus. Up to this, it is transverse. Thereafter, it is sigmoid. Okay. So at this point, it is sigmoid sinus. So asterion, at the level of asterion, what will be here? Here you can see. You can see this group is for sigmoid. This group is for sigmoid sinus. This group is for sigmoid sinus. Clear? Now come to the anterior border. Anterior border have I covered? This anterior border, this one is the anterior superior angle, anterior inferior angle. This border is anterior border. This articulates with the frontal bone, with the superior border of the frontal bone. So this and opposite side this is the coronal suture. So this is the formation of coronal suture, and bregma is the meeting point of the coronal suture and sagittal suture. So this one is anterior border. Now inferior border. Inferior border articulates with the squamous part of the temporal bone. This one. Squamous part of the temporal bone. So this suture is known as squamosal suture. This suture is known as squamosal suture. So this suture is coronal suture, squamosal suture. Okay, squamosal suture. And this border means posterior border. Anterior border, inferior border, and posterior border. Posterior border articulates with the occipital bone. With the occipital, superior border of the occipital bone. So opposite side, similar this opposite side, this suture is known as Lambert suture. So anterior border, formation of the coronal suture. Inferior border, formation of squamous suture. Posterior border, formation of Lambert suture, bilateral Lambert suture. And superior border articulates with the opposite side parietal bone. So this suture is sagittal suture. Clear? So angle border covered up. Angle border, no confusion. Now come to the surface. External surface. This prominence is known as parietal prominence. Okay. These two means biparietal, parietal eminence. These two means biparietal diameter. So parietal eminence, this diameter between these two is the parietal diameter. Ossification starts here. This is the point where the ossification starts here. And biparietal diameter is one of the important. This diameter is known as transverse diameter. One of the important transverse diameter for cranium. Ossification starts here. Clear?
Yes.
Clear? This one is anterior division of the
middle
meningeal artery. Actually, middle meningeal sinus. This group is for sinus.
Sir, sinus টা কি জিনিস স্যার?
Sinus means vein. It is the venous
মানে
vein.
এগুলো সব ওই ভেন সিগময়েড সাইনাস মানে এটা
Sigmoid sinus it's the venous drainage. Dural sinus. Dura matter is splitting to give a space for venous drainage. Okay. So this group is for middle meningeal. The name is middle meningeal artery, but this group is for middle meningeal sinus. Sinus lies exterior to the artery. Clear? And also this group is for at the posterior inferior angle. This group is for the posterior division of medial
Sinus.
artery and sinus. Clear? So internally you will get two groups. Anteriorly, anterior division of the medial sinus. Posteriorly, okay. Externally you will get this parietal
Prominence.
eminence, parietal
Eminence.
and diameter between the two is the biparietal diameter. Externally, in frontal bone, these two lines were superior temporal line and inferior temporal line. So this line will be superior temporal line and inferior temporal line. And attachment is same because this portion from this portion, temporalis muscle gets origin, and in superior here lies the gallia aponeurotica. Gallia aponeurotica. So this one is the superior temporal line. This superior temporal line also extends behind from the frontal bone into the parietal bone, and this one is the inferior temporal line. It also extends from the frontal bone into the parietal bone.
Right.
Inferior temporal line, temporalis. Superior temporal line, epicranial, gallia aponeurotica. Okay, and this portion is covered by gallia aponeurotica, and superior temporal line is attachment of the gallia aponeurotica. Clear? Now, both the surface have covered up. Both the central sulcus and lateral sulcus. These two sulcus you have to identify in this book. After going through the brain, it will be easier. This point is bregma. 5 cm behind the bregma, a line 75-degree angle with the horizontal plane. This is the central sulcus. This is the central sulcus, 75-degree angle. 5 cm behind the bregma. Clear? Here lies the stem of the lateral sulcus. Stem of the lateral sulcus in divides into the posterior rami. Okay, and here two rami. Pars orbitalis and pars opercularis. This will be discussed in brain. So this one is the position of the posterior ramus. So this one is the position of the posterior ramus of the lateral sulcus. Clear? And this one is the position of central sulcus. Central sulcus or lateral sulcus you have to identify in brain. Without going through brain, it is tough to remember these things, these functional areas. But this functional area surface of the brain is easy topic. It is not tough topic. From brain and head and neck, you will get lots of topic that is tough. But usually question comes from the easier topics.